And I'm back with the madness. I'm a champion of the people who don't believe in champions.
Hi, my name's Kara McGee. I'm 29 years old and I was born with Ehlers-Danlos syndrome, type 6. It's a connective tissue and muscle disorder. I've had 36 spinal surgeries due to severe scoliosis and use a wheelchair for long distance. I suffer from pain daily in a way I cannot describe to those who have not experienced my illness. Opioid pain medication has been the only thing to provide some relief and take away a fraction of that pain. Due to my condition, physical therapy makes my pain worse. An alternative, non-opioid medication either does nothing or causes me to sleep for days. Suboxone doesn't relieve pain, and is only causing a dependency to something much stronger than the 7.5 milligram Norco I had originally been on. I am a chronic pain patient and also a recovering addict. My medication was taken away from me because I overdosed when I felt like I couldn't talk to my doctor about the dosage I was taking due to feeling judged for a problem I hadn't had in 6 years. I was 6 years sober. I had been able to reduce the use of my wheelchair, I was able to have a part-time job, and do normal social activities with my friends. I had hoped that I could live a normal life, have a job, relationships, and a family someday. I had even lost 86 pounds due to using my muscles and walking and just doing these daily activities. That was all taken away from me when I lost my medication. Now I hardly get out of bed. When I can force myself out, I now have to use my wheelchair constantly. It's already affected parts of my body I haven't had an issue with in many years. Because the weaker I get, the more the strong parts of my body try to compensate for deteriorating parts. I used to keep my house spotlessly clean on my own. Now I have a caregiver come clean for me, because I can't do it on my own anymore. I can't do a lot of things on my own anymore. I slipped up, one mistake in 6 years, and now I'm being told I must live the rest of my life in agony. This is because my doctor, like most doctors these days, are afraid they will be held responsible if someone like me overdoses on our medications, so they allow us to live in pain. They shouldn't be afraid of providing an option to alleviate one's suffering due to the chance of their patients may choose to overdose on a prescription medication. The fact is, addiction is a disease, but it is a curable one, and it is able to be fought by the person if they wish to do so. And no law, no doctor is going to keep an addict from ODing if that's what they choose to do. If an addict wants to get high or OD, trust me, they'll find a way. I would know. Regardless if a doctor provides it or otherwise. Sorry, cat. Get down. We should be able to sign a legal document waiving the doctor's responsibility in case of an addiction and overdose. If these medications are the only thing that work for me and others who live with this kind of pain, we should be able to have them despite the risk. It's my body, my life. I deserve the right to make that choice. Only I know which of my demons I'm capable of taming, and for me, I've shown I can beat addiction. The pain, however, not so much. No one should have to live in pain. I'm not willing to suffer, nor am I willing to watch others do the same. I've been suicidally depressed since my medication was taken from me. I'm willing to live a quality of life over quantity. I'm willing to wake up every day, work my sobriety program, and fight all temptations that may come my way. To be strong and do my part. Ensure that even if my life may not end up being long, it'll end up being the best version of this life I can possibly live.